So again, this is regarding your ACO, your Baptist Health Texas Network. It is called Accountable Care Organization, is what it stands for. Sorry, something up. So there's several parts to it. One, we have the benefits of the ACO is part of it is you have that coordination of care with your primary care physician. So you're going to have the specialist. You're going to have how many of you guys have seen Independence Day? Independence Day with Will Smith or the one or two. Do you remember they had the mothership and then they had all the other ships that were surrounding the planet? Think of those other ships as your specialists, and you have that mothership as your PCP. They are the PCP is the one that we were trying to make sure that is managing your care effectively and getting you to the right place that you want to be able to go. And because your specialists, they take care of one part of you, they don't necessarily take care of the whole body, but the specialists do, or the primary care physician does. So, but that's part of where it's that the benefit of the ACO is that coordination of care. Okay. Which is why we push really hard to get you guys into a primary care physician, because we know the importance of that. Because if they're taking care of you, they're going to know where you need to go. Okay. It is, if you guys have received emails from me, so we'll say CUPIC. It'll also say Health Texas, because CUPIC is the Quality Partners in Care. It is that partnership with Baptist Health System and Health Texas Medical Group. Okay. And we partner with Aetna. So in a lot of the mailers and things that we have will say powered by, because it is an insurance plan that you guys have with Bear County, but it is the program that we manage. And Baptist is the hospital that you want to be able to go to, and Health Texas is the main primary care physician group that's in that partnership. We do have other providers that are in the ACO network. It's just the partnership is with Health Texas and Baptist. We do operate in 4 counties: Kendall, Bexar, Guadalupe, and Comal County. Those are the areas that we are in. Some of the things that we are going to go over today, a couple of them I may have already talked about, but it's the quality of care, your primary healthcare partners, the hospitals that are in the network, our provider network, what does the ACO cover, and some of the different educational materials that you guys have available to you. So as I talked a little bit briefly about the quality of care, again, it's that partnership, it's that managing the care. You guys are the members, you guys are the ones that we're wanting to make sure that we're taken care of. We want to make sure you're going to the right place at the right time. And so a lot of times, especially in years past, the only 2 places that many people had to go to was they went to their PCP, and their PCP wasn't open. The next place they went to was the emergency room. That's not the case today. There's a lot more availability and other options that you guys have available to you. Some of that is you have same day sick appointments that are available to you. So being part of the ACO program with Health Texas, you could call Monday through Saturday. Our contact center would assist you. You just let them know, I have Aetna Health. There's a specific phone number. That phone number is 210-572-8890. You call that number, it gets to our Health Texas contact center, and I need a same day sick appointment, and they would work to get you in at one of our 18 locations. Okay. If you are a Health Texas provider or patient today, you're not necessarily guaranteed to see your provider or be able to get in at the clinic that you were already established at. You're guaranteed to get in. Okay. So just know that. But even if you're not established with a Health Texas provider participating in the ACO program, you can go to one of our Health Texas primary care physicians, and it's the same copay that you have for a PCP copay, because Health Texas is primary care. So you're not paying that urgent care copay or an emergency room copay. And we do have 2 clinics that are open on Saturdays from 8 a.m. to 5 p.m. Our Worst Spot clinic and our San Pedro clinic. Okay. And it's going to be the same thing. You'd call that contact center and they would work to get you in. We also, again, you also have the urgent cares that are available to you as well. We have 74 urgent cares that are in that network today. 30 of them, I believe, are pediatric locations. And so we have maybe 20-ish are pediatric locations. So like the Little Spurs pediatric and Hopscotch pediatric, some of those are now in our ACO network. And then we have more regular urgent cares that are in the network today as well. So Care Now, just so that you know, is not in our ACO network. They are not, because they are tied to Methodist. The Care Now locations were at one point MedPost, and they were Fast Now. And when they merged and they got bought out by Care Now, those locations are no longer in the ACO network because Care Now is part of it, Methodist. Okay. So we do also have extended hours. So a couple of our locations do have extended hours for those, especially for those individuals who already established with Health Texas. There are some televisits that are available from 11 a.m. to 7 p.m. We do have an APC that is available for televisits for established patients already. There are some providers that are seeing new patients in the evening as well, but that's the one location that is our Stone Clinic that can see patients on Tuesdays after until 8. We do have our Las Palmas Clinic and our Ingram Park Clinic also have 2 days a week where they're doing extended hours, but those are for patients who are already established. But if you have a same basic appointment and you're already established, those are available to you guys as well. And then our case managers. So one of the other parts that's in there is if you go to the ER, if you have an inpatient visit, if you have or if you have multiple chronic conditions, say somebody in your family has diabetes and maybe they have hypertension, or maybe they have hypertension and high blood pressure. Those are the things. High blood pressure and high cholesterol. They would help work with you to manage those issues. If you have digestive issues, we also have other places that we can get you to that are in our ACO network as well. So the care management team will work with you. They will outreach to our members. So sometimes you may hear somebody may call you and they're letting you know they're part of the whole health program. They're one of our case managers that's engaging with you because you've had a recent ER visit, or maybe you've had a recent inpatient visit, or you have more chronic conditions that they're trying to help and see if you need any assistance, find anything that's in the network. And upon discharge, they want to make sure that you understand your orders and that you've scheduled your TCM follow-up visit, which is that transition of care. They want to make sure that you've scheduled those visits so that you've gotten in to do a follow-up with your primary care physician. And if you don't have a primary care physician, we work to get you established with one. So that way you're getting that treatment that you need. Okay. As I mentioned earlier, we have Health Texas is the main primary care physician group that's in the partnership with Baptist. So Health Texas has 18 locations. And again, some of our clinics are open at 7 o'clock in the morning. And then the majority of them do close at 5, but we do have some that have a couple that have extended hours now. And then we also have the 8 to 5 on Saturdays. We can do new patient appointments on Saturdays as well. If we do a new patient appointment on Saturday, just know it will be, or if you have visits on Saturdays, just know that those are rotating providers. So you're not necessarily going to see the same provider that you saw the last time. Okay. But we can do those appointments on Saturdays as well. And the other good thing about, even if once you are established with the Health Texas provider, you do have access in reality 24/7 to a primary care physician, because we do have a provider that's on call. When the office closes, there's a provider that's on call. So when you're established, they can go in and look at your chart, see if there's a history, check information, and if they need to, they'll reach out to your provider. Otherwise, they'll say, okay, well, I can submit a prescription, I can do X, Y, and Z. But that part, that 24/7 care with Health Texas, is for those patients who are already established with Health Texas. You also have the Hilo app, which you'll download on your phone. And when you download that on your phone, you'll be able to look at your your statements and your future appointments. You can also pay your invoices on there, and you can also, if you have questions with your primary care physician, you can send questions to your PCP, and then you can also do virtual office visits that way as well. So even if you can't get over there, they can do that. They can do a televisit with you. There we go. So the Baptist Health System, which again is the Baptist hospitals, that does include Resolute, and which is in New Braunfels. And then Baptist just opened up that Westover Hills hospital as well. So all of those are Baptist facilities that are part of our ACO network. Those Baptist neighborhood hospitals are also part of our ACO network as well. Okay. But if it's not a true emergency, go to the urgent cares or call your primary care physician. So if you're having strep throat or pink eye, those aren't emergency room visits. So we want to make sure that you're going to the right location for the right care. Now, the other part of this is, if it's a true emergency, you're having a heart attack, you're having a stroke, you're going to the nearest emergency room, regardless whether it's Baptist or not. Okay. You want to because that difference could be a difference between life and death. You're going to the nearest ER. So if Christus is your nearest ER because you're having a heart attack, then Christus is where you're going to go. Okay. But for procedures, those sort of things, you want to make sure you're going to the Baptist facilities. Our labs that are part of the network. So you also your imaging. Let me talk on that a little bit too. The imaging, such as your mammograms, your CT scans, your X-rays, the MRIs, Baptist M&S imaging is what is in the network. Okay. So strict is not part of the network. For those pieces, it's going to be Baptist M&S imaging. The Baptist does have 7 hospitals, because again, last year they opened up the Westover Hills location. I know it's probably not going to happen for another 2 or 3 years, but they are looking at building a hospital out in Barney. They bought that land like 4 years ago, but Westover Hills was where they decided to start and build over there first. So they do already have land in Barney. They just haven't done anything. They haven't started building yet. And there's 9 of the Baptist neighborhood hospital. So those are in the different areas as well. I do have a quick map here so that you can see what it looks like with the Sorry, I'm looking at that one over there, and I'm seeing it on the televisit with the Hilo app. It's not moving. So we do have a quick network that would map that is up here. And that network, we have so you'll see the different urgent cares. There's quite a few urgent cares that are part of our ACO network. We also have the pediatric urgent cares as well. And the pediatric urgent cares are the ones that are in purple. And the different physical therapy groups. And you'll see the different locations with the imaging centers. Some of the imaging centers are standalone. Some of them are in the same buildings as the hospital. And then you'll see the hospital locations as well as the Baptist Neighborhood Hospital. Here, our PCPs and our OBGYNs, you'll see that we have over 400 primary care physician doctors that are part of our ACO network. That's not necessarily, we have 450 locations, but we do have over 400 primary care physicians that are part of our ACO network today. And we have added, Medcare is a primary care physician group that we just recently added to the ACO network as well. We have 74 urgent cares. Again, some of those are pediatrics, and then the others can see everybody, whether they're kids or adults. We already touched on the imaging centers. Again, it's Baptist Seminole Imaging that you'll want to go to for the different screenings. We do have Baptist Seminole does give us for mammograms. They give us Saturday dates that are available. So that's what those pink flyers are. It's the Saturday dates that we have for mammograms that they can schedule. And then the labs that are part of our network is LabCorp, Quest, and CPL. And if you're with the Health Texas provider, the Health Texas labs are part of the ACO network as well. So when you go to your primary care physician, if they're not Health Texas, you do want to make sure, or your OBGYN and they run labs, you do want to make sure that they're sending those labs to one of our in-network labs. So if they do them internally and run them, let them know that your labs, after they draw them, needs to go to one of those in-network facilities. This is just a quick, what you can do when you're sick. Again, you have the same day sick appointments. Mine, you have the urgent cares. You can also have Aetna's 1-800 telenurse line. You also have your teledoc that's available to you guys as well. And the Aetna's 1-800 line will help direct you to the right course of where you should go. You do have, again, you have the teledoc. You also have the CVS Minute Clinics. So if you have a CVS Minute Clinic that's around you, that's also in the ACO network as well. There are 3 Texas Med Clinics that are so there's something going on. Give us 1 second. So we also have Texas Med Clinic as one of the urgent cares as part of the ACO network. There are 3 Texas Med Clinics that are open 24 hours. So just know that is an option as well. I do think that after 11 o'clock or 11 p.m., I do think they charge an after hours fee that's not covered by the insurance. I don't know what that fee is, but so I think it's from 11 to about 7 o'clock in the morning that they charge that fee. So just know that. One of the biggest questions that I usually get is what happens if I'm out of town, or if I get sick and I'm out of town. You do have that's where those televisits can come into play. And again, you have teledoc that's available to you as well, whether you're out of town or not. You also can get a virtual visit with your primary care physician. So those are options that are available to you. Again, if it's a true medical emergency, life and death, it doesn't matter whether you're in San Antonio or out of San Antonio. You're going to the nearest emergency room if it's a true medical emergency. Okay, but again, if you go to that out of town emergency room because you had strep throat, that's not considered a true emergency. So that's not going to be covered. So but if it is a true emergency, then Aetna's going to cover as if it were a network. Okay. But again, you do have the Aetna nurse line. You do have the teledoc visits. You also have your virtual visits with your primary care physician, and then you can pick up prescriptions anywhere within the country when needed. So you're not limited to San Antonio and, oh, I can't get my prescriptions and stuff. No, those are covered nationwide. And if I'm not mistaken, I think they're even covered if you're out of, yes, even if you're out of the country, you can still get your prescriptions. Okay. So just know that those are options that are available to you. These are some of the locations that have extended hours, and again, our Saturday hours as well. We do have some clinics that are open at 7:30, some that open at 7 o'clock in the morning. And then I know on Wednesdays, because the providers are doing training, they open at 10 a.m. But the other days of the week, the majority of the clinics open at 7 or 7:30 in the morning. And then again, we have those 2 clinics that are open on Saturdays as well. We did touch already about the case management program. There is a specific number. So even if you went to the ER and you want to reach out to the case management team, you can do that as well. Or if you have questions about your chronic conditions or things of that nature, you can reach out to them yourself as well. That number is 210-268-1698, and it'll get to one of our cubic case managers. We do also have health talks that are for everybody as well. So just know that too. You have access to mail order pharmacy. So just know that is available, and you can go, if you aren't doing mail order pharmacy now and you have prescriptions, you can make sure you get 2 prescriptions from your provider. The first one is going to be a prescription that has a 30-day supply, so you can get that filled at the pharmacy. And the next one would be your 90-day supply, because that's going to go to the mail order with CVS. And so they can get that through the system and get it processed so you can start getting your prescriptions via the mail instead of going to the pharmacy. There is a fax number that you can send the information to. There's also the link that I have in the slides that is available to you, that you can go onto the Aetna website and pull that and get that filled out by your provider so that you can get that taken care of. If you have not scheduled or found a primary care physician or are looking for a specialist, you can go to the Aetna website and look at it. You'll go to the Aetna.com/docfind.com, or you can also just type in www.docfind.com, and that actually take you to the Aetna's website. And you can either continue as a guest or register. If you register and you put in your information, then it'll pull up your network that's available to you. If you decide you want to continue as a guest, you would just select guest. Make sure you select the Baptist Health Texas network, where it says Aetna Whole Health Baptist Health Texas, and then you can do your provider search that way. You also have a concierge, that can help you find a primary care physician as well. Okay, so you can send me an email or you can call. If you call, please leave a message so that I can respond back to you, because if I'm at an event like this, I'm not going to be able to answer the phone. If you send an email, I will respond back to you. We can go back and forth via email. Sometimes that's easier for you guys because you're working and can't really be on the phone, and so we can go back and forth that way. This is what it would look like when you go on. You'll see the Building Your Care team on the left-hand side. It says, "Are you already a member?" If you're not registered here, register now. On the left, it says log into your secure site. So if you've already registered, you would just go and log in. On that site, you can also see your claims. You can also print out a copy of your ID card. You can also request a new copy of your ID card. So there's a lot of different things that you can go in there to see. If you decide to continue as a guest, these options that are over here to the left where it says Aetna Whole Health Plans, you can select any one of those three, and it's because all those networks are the same. And this is what the ID card looks like. It's that gold card. You guys probably already have that in your wallet, but just so that you know. We do have our CUPIC website, which is called qpicsa.com. We have a lot of information that is out on that website. There is a member guide booklet. There's also an Aetna video on the ACO program. There is for us women who need mammograms. There's a place on there where you see mammogram scheduling. You can actually schedule your mammogram with for Baptist Eminence Imaging. There it has the dates and locations and the times that are available, and they're in 15-minute increments. And right now it goes through June, but we do constantly update that. We also have our different health talks that we do as well, that we're putting out on that website too. So the other, again, this is just a quick summary of our goal is for you guys to have a positive experience with the ACO and make sure that you guys know what you have available to your point of contacts. And if you ever have any questions, you do have somebody that you can reach out to. So again, for example, you have me as your concierge. I'm your dedicated network provider, or not provider, but navigator. And so my number is the 210-920-9301. And you can reach out to me there, or again, you can email me, which is that heather.williams@healthtexas.org. And I will periodically, I do send emails out letting you guys know about upcoming events or just quick reminders, like if we have a holiday, remember this, where you can go information, or if screenings are coming up, we might send some notifications out, reminder, get your screenings, or reminder, if you don't have a PCP, let us help you find a PCP type notification. Again, the same day sick appointment line, which is at 210-572-8890. And then the case management services, just remember you have that available to you. They want to engage with you guys. They want to make sure that everyone has a good experience, and they want to be able to help everybody. That's part of the program. Again, the welcome video that's out there that Aetna has is it's myaetnawholehealth.com. They have other information that's on that website as well, so that you have more access and more information at your fingertips too. Please visit our website. Again, it's at qpicsa.com. There's a lot of good information out there for you. There's primary care physician information out there that's with Health Texas, MedFirst, and our other providers that are part of our ACO network as well. The OBGYNs that are part of our ACO network are out there too, and as well as pediatricians. So if you guys have kids and are looking for a pediatrician that's in the network, that information is there too. Again, we talked about the mail order. We do have our monthly wellness article that goes out to everybody as too, plus the different health talks that we have. So you saw earlier, we have that testicular health talk that's coming up at the end of the month. So there's a lot of different things. We try to coordinate and do different topics based off of the monthly awareness and other pieces that when you guys have given us suggestions, we can try to incorporate those suggestions into our health talks as well. Again, our model is really trying to take care of you guys, but getting the biggest piece is getting you guys in with that primary care physician, because you got to get your annual physicals in. If you don't get those annual physicals in, you're coming in when you start you're not feeling well, they can't catch something early. And some of that is making sure if you're getting those colonoscopies, getting those mammograms, those are well woman exams, all of those are very important. And just overall managing our care, because if last year you may have not had any issues, but then you go into your doctor's office this year, they draw blood and they find something. They know it started sometime in the last 12 months, depending on how often they've had you come back. And so they can manage it more quickly because it's been caught earlier. And then just remember, you do have those telemedicine options available to you that are 24/7. You also have, and referrals are not required, part of our ACO program. But we do want to make sure that you're getting in with your primary care physician. Because again, sometimes we think we need something and then we don't realize that our provider can actually treat that. And so and then if the provider's helping with that coordination, that information's also getting back to your provider. And that's a key as well, because the provider, you want your primary care physician to know about your health or where you went. And they're not going to necessarily know that if they haven't been involved. Are there any questions? Whether you're on chat or on Zoom or in person. No? Okay. Well, then that is the presentation for the ACO. If you guys do have questions later, please feel free to call me or email me. That's what I'm here for. Okay? Yes. So we're recording it. So once the recording is available, I'll be able to send it out to everybody. Oh. And then I'll also send it to Edith as well.
And you had mentioned like this emails. I don't think I've been getting anything regarding them.
Okay. Do you know if you gave your email address to Edna? Okay. If you want to, I can get your information afterwards, and then I can check. Okay. Because right now it's coming from heather.williams@healthtexas.org/constant contact.
Like I feel like some Edna emails, but things are like in detail as far as like for this
program. Okay.
More like general.
Okay. Yeah, and mine's going to be more. Some of it lately has been about health talk, this upcoming health talks, but others have been about reminder that this is part of your ACO network, where to go type thing.
And they said that Health Texas is more the primary for PCP. Yeah, I already established PCP, but it wasn't with Health Texas, it was Wellness.
They're part of our ACO network too. Yeah. It's just Health Texas is in the partnership with Baptist, but we do have other providers that are participating in our ACO program. But you just know that you can still come to Health Texas if you need a same-day sick appointment and you can't get in with WellMed.
Okay.
And hello, everyone. I am the on-site bear representative for Aetna. So my name is Carmen Torres. If you all have any in-depth questions about your Aetna plan, you can contact me. The email will be aetnarep@bear.org. So I'm available if you all need me.
So other than that,
there is one question online. Do they have to register Whole Health website if they already register at the Aetna website?
register as far as?
Do they have to register in two places, Aetna.com and Cupid?
No. Once you've registered with the Aetna, you can go on there and check everything out. It's just when you're going to our Cubic website, it's just so you can see different information as far as primary care physicians and whatnot that are part of our ACO network. And plus, there's a lot more detailed info for the ACO in general that's available to everybody. But you can, because the Aetna's portal is going to have primary care physicians that are part of the ACO network too. Sometimes we have providers that are that we can see that, but Aetna's website has them. They're not in the directory, so we do want to make sure that we're meshing and we're making sure that where everyone's going is in the network. And our website has, again, it has more detail because take care of the ACO itself. And I manage the network in general, so. Hope that answers the question. Were there any others?
No, that's it.
Okay. All right. Well, if that's all the questions, then that concludes our presentation, and I appreciate you guys joining us today.
Thanks, Heather. Thank you, Heather.
Oh, so they would rather us use the Keep It website. You can use both. Again, the Aetna's website, you're gonna be able to see claims. You're gonna be able to request your insurance ID card. You're gonna be able to request other necessary pieces of information. It's just our Cubic website has more in-depth information regarding the ACO itself. I have a provider tab over there that has a quick reference guide of, so if you're looking for an ENT, you're looking for or chiropractors, or you're looking there's literally a quick reference guide that you can pull up, and you'll see the different groups that are participating in our ACO program. So we tried to look at what my providers with Health Texas were asking me for frequently, and put that, and so that quick reference guide was put together for that. Then there's a quick reference guide in there for the ACO, so it's got all kinds of different information that's available to you. And so I would say use both, because you've got pieces that we can't do on our Cubic website, like you're looking at your claims, looking at the requesting an ID card, but the Cubic website has more in-depth info for Cubic itself and for the ACO program. So, yes, we'll get information to everybody. We did record this presentation, so I will send out this, once it's available to me, I will email it out to everyone that registered. And then, I can also send the PowerPoint slide to everybody as well. Are there any other questions?
Want to walk them through the website, the Cupid website?
Oh, I can. So the Cubic website is live, so you'll see up at the top, it has doctors, and you can go and look at click on the primary care physician, and you'll see a map. So if you wanted to, you could actually put in your address, and then you can do a search of, let me put in this address.
No.
And then I can come down here, do a radius, and I can tell it, I want to see providers that are within a 5-mile radius of me. And then it'll show me all the providers locations that are within a 5-mile radius. And then if I click on that provider, so like with this address that our San Pedro clinic is the closest, it'll give me how many miles. It's 1.13 miles from here. And it'll give me the phone number and their address. Okay. You can do the same thing with the pediatrics. You can do the same thing with the OBGYNs, the hospitals, as well as the urgent cares. We have behavioral health information out here as well, so that if somebody is needing that behavioral health issues, you can go there and pull. It'll give you some detail. And where I was talking about with the providers, if you come over here to the providers tab, there's a quick network resource. You'll see it says pediatric or non-pediatric. We also have the DME, Aetna's provider list, which is the DME equipment. So if you need prosthetics or those sort of things. The CBS Health Mental Wellbeing, we have a list of their virtual facilities that are in the ACO network as well. And you just have to look if it says nationwide, they're covered in Texas. If it doesn't say nationwide, you just have to make sure that it's available in Texas. I got that of it.
That's okay, just type it in.
So again, going back to the providers tab, you'll see, so let me do the non-pediatric. This is the quick reference guide that I was referring to. You'll see it has the Baptist contact information over that we reach out to. We also have JTA Wellness, which is a nutritionist group that's part of our ACO network, and they offer 10 free visits a year. And because it's covered as preventative, and their goal is nutrition to help members. If you have chronic conditions, they'll help patients. Our physical therapy groups that are participating in our ACO network is here. So we tend to, HealthLink is part of our ACO network. Okay. The challenge that we have with HealthLink is HealthLink's tax ID number is the exact same as the Baptist Hospital. So what's happening with patients is they will get, when they go to a HealthLink, even if it's not in a Baptist facility, they're being charged a facility fee. So they're being charged their deductible versus their copay. So we tell people don't go to HealthLink unless the plan has made that specifically that regardless if they're doing physical therapy in a hospital setting, it's covered by the copay. But otherwise we say, go to one of these other physical therapists that's part of the ACO network. Okay. But that's why. It's because their tax ID number is the same as the hospital. You'll see we've got ENT that's in here. We also have our behavioral health. There's the sleep studies, so where you can, if your provider's wanting you to go get a sleep study because they think you might have sleep apnea, there's a place for that's the locations you can go to that are part of our ACO network. The dermatologists that are part of our ACO network. Again, the prosthetics. We have orthopedics. Bexar County does offer bariatric services. So bariatric services are out here as well as far as what's in ACO network. So there's just a lot of different information that's here that we've seen our providers ask frequently for. So we've tried to make it very easy for you guys to be able to retrieve that information yourself. And where I was talking about the resources, we also have, so there's membership tools. So you can see the membership guide that we put together for Cubic. It's just, again, it's got a lot of information. Some of it are things that we talked about already today. But it's got a list of the primary care physicians in pediatrics that are part of our ACO network. Again, where I can go if I'm sick. The different urgent cares that are part of the ACO network. We also have dispatch health. I did not talk about that. I talked about the urgent cares, but dispatch health is an urgent care that's part of our ACO network. They come to you. They're open 8 a.m. until 10 p.m. 7 days a week. Okay, so they can actually come to you. The areas that are in blue are the areas that they go to. So there is that one little snippet in San Antonio that is like white. That's because that's Fort Sam.
Oh, can't go there.
No.
Nope. That makes sense. Okay.
Right. They are in New Braunfels. They're not in Bernie. So if we have anybody that lives out in Bernie, they don't go out to Bernie yet. They are also not in Canyon Lake area, but they are in New Braunfels. They're in Schertz. They're in some of the other surrounding areas. So just know that is available to you as well. They can also come to your work if you want them to.
Oh, wow.
So just know that is an option on top, as well as the other urgent cares. And then this is a quick look of the urgent cares. I can tell you right now there are more. So my marketing people is going to have to update this because it's not everything. It's not everything because we added more primary care to the ACO network or primary urgent care. But so a lot of this has the same information. Some of the things that we talked about. Oshi Health is it's a digestive, virtual digestive group. So if you have bloating, you have chronic digestive issues, maybe you have, you have constant indigestion, those sort of things. They can help manage that. They're open 24/7, 365 days a year. So even if you have issues at 4 a.m. in the morning, they can work with you. If you've been diagnosed, they have a gastroenterologist that's on staff, and they would work, that's where you start, is with the gastroenterologist. Then they go to, from the gastroenterologist, they also have behavioral health as well as nutritionists on staff as well. So once you started here, they figure out what's going on. They move you over to the nutritionist, or where they think you, because stress itself can impact your digestive issues. And so sometimes we actually do need that mental health piece, because everything's stress related. So that's where they start here, and then they go here. And if you have not been diagnosed, then if they need a brick and mortar gastroenterologist group, they are working with Gastroenterology Consultants of San Antonio, who does our Saturday colonoscopies. So they're working with them to get members in, so they can get those testings that need to be done, so you can get diagnosed. So, because that's one of the questions people like, well, yeah, but if they're virtual, how can they do the testing that I need? They will get you to an independent, an in-network gastroenterologist that's brick and mortar that can do the screenings for them. And then they also share that information with your PCP as well. Okay. Again, these are the urgent cares. We also have the breast centers that are part of, and imaging centers that are part of our ACO network. And so, again, that is just a brochure that we have that's out on our website that has a lot of the information that we talked about in the presentation, and a few other things. Let me get out of that. There's also, we have our wellness articles that are out on the website too, as well as, so those calendars that have the healthy recipes in there, they come from our wellness articles that we do. So every month we put a wellness article out there. It has healthy recipes on there. So every year we take those recipes and put them in a cookbook. And again, there's just a lot of information that's out here for you guys. And then these presentations, that YouTube page that's out there, all of these presentations get placed out here as well. So any of the presentations that we've had in the past, whether it's been last year, the year before, or even this year, those videos are all out here. So the combating stress in the workplace, that's the one that we just did 2 weeks ago. That's already out here on our website. So just know that when we had nutrition series, we had a 4-part nutrition series recently. Those are out here as well. So we do have a lot of information, health talks that we've done in the past, plus pieces that come together for pubic. Just know you guys aren't alone. We're here to help. Okay.
And you have your entire benefits team. You have Cindy Navarro over there. She's our benefits specialist. And you have Ms. Nalda Tanaka. She's our retiree specialist. And then you have Addie. She's new to our team. She is a leave specialist. And of course, I'm here, Ida Davina, with Carmen Torres. Carmen's new to our team as well. She's our Aetna rep. So we are here to help you. Just reach out to any of us and we can help. Thank you, Heather.
You're welcome. I think there was one other question that was talking about an app. So Cubic does not have an app. I know Health Texas does, which is that Hilo app, but but Cubic does not have an app at this time. I know that Aetna does have their app for their portal, but Cubic does not. At the moment, it's the website.
And ACO members can also use telehealth.
Yes. So I'm going to stop recording, and I do appreciate you guys joining.